Thank you so much. Welcome, everybody, to Spine Time. My name is Roger Hartle. I'm your moderator today. Today, we have a fascinating topic. We're going to talk about sleeping. Better sleep equals better spine. As you know, I'm the neurosurgical director for spine at Weill Cornell, NewYork-Presbyterian Spine at Cornell. And I'm one of the co-directors for the Center of Comprehensive Spine Care on 59th Street and 2nd Avenue. We have Ricky Singh here tonight as one of the participants. Most of you will know him. And Anna Krieger, who's a neurologist. I'll introduce her in a second a little bit more. For those of you who may not be that familiar with the Center for Comprehensive Spine Care, we're located on 59th Street and 2nd Avenue. Our goal is to diagnose, manage, treat, and help you with recovery from any possible spine problem that you may have. And we're doing that by combining the expertise from neurosurgeons, orthopedic surgeons, pain management, sports medicine, neurology. And we work very closely with integrative health, for example, radiology, and other physicians across the New York Presbyterian Spine group, but also Weill Cornell on the Upper East Side here. And today, as mentioned, we'll talk about sleep and how sleep can be important in your spine health. We have Anna Krieger here, who is the chief of sleep and neurology division at Weill Cornell, the neurology group. And we have Ricky Singh, who most of you know, of course, as the medical director of rehabilitation medicine at Weill Cornell. Now, Ricky Singh is very interested in sleep this week because he's running the marathon this Sunday. So I'm sure he'll give us some extra advice and some really precious hints and tips for how we can get better sleep. So, but we'll get started with our first slide, and maybe Anna Krieger, if you want to get started and tell us a little bit about the background, the key elements of sleep.
Thank you so much for the invitation. Really a pleasure to be here with you all today. And so we have just a few minutes. So I think the idea is for us to get started with an understanding of how do you achieve adequate sleep. And I think it's very hard for anyone to sleep well unless those three key elements are addressed. One is the duration of sleep that many of us talk about, and we're always sleep deprived, or we may not have enough time for sleep. The other is the timing, which means at what time you go to bed and the time you get up. And the regularity of that timing of sleep is very important because sleep is a natural rhythm of the body. And the third element is the quality of your sleep. So we have to always try to address those points. Duration and timing is a lot more under our own control. So that's something that I always like to talk to people because there are things you can do at home to really optimize that. Quality of sleep typically needs to be discussed with your doctor, and that's when the doctors can really help you address what might be happening during your sleep that is really impacting the quality of your experience at night. So on the next slide, we're going to see a little bit about the duration of sleep. Years ago. And over time, with the use of electronics or bringing computers to the house, we have really stopped having that allocated time for sleep and have more activities that would interfere with our nighttime life, right? Before, I remember when I was a kid, television would just stop at a certain point. You could decide to try to watch, but there was nothing on the television, right? And slowly people started bringing work home and then leisure home. People bringing their iPads or their iPhones to the bed. Many people sleep with that under their pillow or on their beds. So this is really now impairing our ability to preserve the time that should really be allocated for us to rest. So we have to pay attention how to really restore that. People often ask, how long should we sleep? And on the left, I just highlighted in red, typically we say between 6 and 9 hours. However, we can see over time, people have getting closer and closer to 6.5 hours or so. Luckily with COVID, we're able to stop commuting. Many of us were able to improve their duration of sleep. And it seems that sleep really hasn't declined in terms of duration, but you can see how it could really kind of get better to the levels that it used to be. And we have control over this. So I would suggest looking into your schedule and trying to figure out how do you prioritize sleep, make sure that evening activities or morning activities do not impair, or they are allocated to different times in order to preserve your typical sleep duration at night.
Dr. Krieger, real quick, as a neurosurgeon, we don't sleep that much, or we tell our residents to sleep faster, not longer. But I'm sure there's a component of age, correct? There's probably younger people sleep more or are supposed to sleep longer. Is that true? Or what can you tell us about age and sleep?
Absolutely. So two main factors with age. When we are younger, or let's say if you have adolescent kids, you see they can sleep for 10, 12 hours. And that's normal. We kind of have younger kids that need a lot of sleep. As they get into their early teens, they may not need more than 9 hours. But in later teenage years, they may need between 9 and 10 hours. Most adults, though, would then normalize to that 7 to 8 hours range. About 1 in 100,000 people may need less than 6 hours, but some people in the same amount may need more than 10 hours, which we call hypersomnia, or people that need a longer sleep duration. As we get older, our sleep tends to become more fragmented, and we see that with aging in most groups. A little bit worse in women after menopause, so that interferes with our sleep quality as well. And sleep, by being more fragmented, the overall duration of sleep may not be as much. Some people make the mistake, in order to have more sleep, they stay in bed for many hours. And that's something we don't recommend, because sleep is almost like an older rubber band. If you stretch it too much, it will start fracturing. So we need to make sure people go to bed and get up at a regular time, but never spending more than 9 hours in bed for most adults, typically between 7 and 9 hours in bed.
Maybe it's a good time to get Dr. Singh involved in terms of sleep duration and pain, and maybe you're going to talk about that later also. But I was wondering, we see so many patients in the spine group, in the spine center, obviously, who suffer from pain, either chronic pain or acute pain. What's the relationship between pain and sleep? Is obviously it may be difficult for people to sleep when they're in pain, but if somebody has pain and they can't sleep, is sleeping good for patients who have pain?
The challenge is a lot of patients, and even people we talk to, really put a lot of stock into some of the materials around sleep, mattresses, pillows, all these types of things. And we try to emphasize it's not those things that are causing back pain, it's what you do during the day that's going to prevent you from getting back pain. So if you're exercising, if you're working on posture, if you're sitting at the computer properly, if you're staying mobile, that's going to help your pain better than focusing your attention on the optimal mattress or pillow. That being said, people with chronic pain certainly have a more difficult time falling asleep. And they also have a poor relationship with sleep, just what Dr. Krieger was saying. Sleep is something that we need to practice, just like anything else. I have 2 little kids, a 6 and a 3-year-old. And we quote sleep trained these guys. We taught them how to sleep. And I think with age, we all kind of forget that. We take our phone to the nightstand. We're looking on TikTok. I know, Dr. Hartle, you're fancy on TikTok and Instagram and things like that. Blue lights in our eyes, and we can't sleep that well. So we kind of have to disconnect and retrain ourselves to sleep. And when you're in pain, that relationship just gets, destroyed. And now we rely on caffeine and stimulants and to wake up. And then the other side, we rely on other medications with Dr. Krieger might talk about to help us sleep, like Valium and things like that. So it's really about retraining yourself and doing these behavior modifications that optimize sleep.
So there's a close relationship, obviously, between how we feel, the pain sensation, and probably the quality of the sleep. That's interesting to point that out.
Right, and it has a bi-directional relationship, right? If you sleep poorly, you may feel more pain as well. You're more sensitive to pain, and if you're in pain, you don't sleep as well. So that's definitely a challenge. But I completely agree that what we do during the day matters as well. And this is why this chart is now talking to us about the timing of sleep. So there is a rhythm that is controlled by several neurons. We have specialized neurons that sit just right behind our eyes. And their task is really to monitor the outside environment for light. So they are light sensitive neurons that process the information into the brain to tell you, is this day or night? Because imagine when we lived in nature, that was only the cue we had. We didn't have clocks or times or, computers or anything to tell us what time it was. So as the sun comes up, we have this alerting system that it starts to get activating, and we have to match that to our activities. So you need to get out of bed on time, stand up, have your light exposure, make sure you're not in a very poorly lit environment during the daytime, and be active physically, which will help you then deactivate at nighttime. So when the wave of sleep comes, that should be matched with darkness. And as Dr. Singh mentioned, I love blue light blocking glasses. I have them on my desk. I have them on my nightstand. If I'm working late, I put the glasses on, because the idea would be that glasses like this will reduce the amount of blue light that we get exposed to from electronic devices. Lights to lights that really are blue focused, so they really don't have that dim feature or the yellowish feature that we tend to have in more natural lights. So we have to be yes, I'm sorry.
No, I'm sorry. So when do you wear those glasses?
Typically an hour before going to sleep, I would put them on. Even if I'm out the apartment, or if I'm on the computer, for sure I would put them on. The only challenge will be that if you're doing any color-coded graphics, the colors will be off, but you can see the content and you can work. So this will guarantee that the melatonin that should now be released as the darkness comes into the eyes will be preserved. Because if I have one of those electronic devices, which you may show it even on the next slide, you're going to see, when we use our iPads, you can see it's almost like you have your personal lamp, right, shining on your face on the left. And that is telling the brain to stop producing melatonin because it's daytime. So the brain messaging, which is all chemical, gets to be very confused. I often tell people that sleeping well is almost this beautiful orchestra that plays together, and all the instruments are all fine-tuned and everybody knows what to do. The light is disrupting that. It's like you have one instrument that's out of sync or out of tune or is broken. So that's why we have to try to do as much as we can to preserve the natural process of sleep.
Dr. Krieger, a lot of these new phones and iPads and devices have this other feature where you can control the blue light. It's called like nighttime or true tone. You find that these are as effective? I know sometimes at night when I just wake up, I roll over and turn my phone on to see what time it is. And all of a sudden I can't sleep anymore because some lights hit my face and that's it, I'm done.
Right. And not only that, don't check the time at night, because we have genes that we call clock genes. They are there just to track time. So if you know what time it is, you activate parts of the brain that will keep you from sleeping. Now, on the questions of those applications that can change the light scheme, I love that. I think that's very helpful, the like dark or night modes, but it's typically not sufficient. But the other aspect when you use electronics besides the light is the content, right? The check in the clock is the content. Oh, there's a number. You kind of estimate how much longer do you have for sleep. But sometimes people read things that can be aggravating or interesting. Even if they're not aggravating, they may be interesting. And that, again, creates more light bulbs in the brain that they can really shut off to allow you to sleep. So we have to be very mindful. And I love your analogy with the kids, because that's how we train them to respect sleep. And that's what I want people to relearn. How can we respect the sleep? It's part of your nature. And we have been very abusive in our relationship with sleep. We have early morning meetings, early flights, late computer sessions or reading. Sometimes people read or they binge on Netflix or whatever it might be until late at night. That really is impact our quality of sleep. So we have to really learn how to be very respectful.
There's an interesting question about light pollution, I guess, having neighbors with bright lights or outdoor lights. I guess it's a typical Manhattan question. You sleep and the light seeping in from the outside. I would think you you lock your door and you shade, you put the shades down, right? Or any other suggestions how to protect your sleep?
Yeah, I love that question because I actually have a slide I didn't bring today, but I took pictures from my previous apartment from the neighbor's lights. I had someone across the street from me that had the brightest blue light 24/7 in the apartment, right? And it was facing my bedroom. So I had to get the best kind of blackout curtains that it was possible. I actually made them myself at the end because they could never be perfect. And it really helped me sleep well. So you have to figure out how do you preserve your sleep by cutting that, and also be respectful to your neighbors. If you're the one that has those bright lights in the living room, let's say, make sure you shut them off, because the bedroom environment has to be quiet, it has to be dark, it has to be cold. And that's how we sleep the best. And that's what we have on this slide. Now we're talking about sleep quality, right? We spoke about what you do during the day. If you're physically active, if you have light exposure, if you stand up, many people are very sedentary, you sleep better. What you do before going to sleep matters, right? So you shouldn't exercise just before going to bed, because that is a very activating process. So you should be able to relax and try to allow this change into sleep to occur, which is not a switch. You can't just go from awake to sleep mode, same way that you can't just jump out of bed and go and drive a car, or a pilot can't fly a plane right away. You need to fully wake up to be able to have the adequate performance that you need. The environment, we spoke about how it is, you have to be careful before going to sleep, during the night, and in the morning. You need to have enough lights to wake you up as well. So we have nighttime alarms that are light alarms, that the light increases in the morning, almost like a simulator of the sunrise, and that can help people wake up and feel better as well.
Dr. Hartle mentioned earlier that I am running the marathon this weekend, so I have some questions for you. And people are talking about banking sleep. This week I'm going to be anxious, I am a little nervous, and that's probably normal. So they're saying bank sleep earlier in the week, start sleeping earlier and earlier, to just in case the night before I don't sleep well. Is that a thing? Is that something that our body can kind of harness and store in advance of maybe a poor or restless night?
Yeah, you can do a little bit of that. You can never do enough to overcome a major, let's say if you're on call, right? Emergency room physicians will do that. In the past, when they had this shift, they would work a night here and then a day there. So they would try to bank some sleep so they could perform really well at night. So you can do that, but you have to remind yourself that there's always a constraint. You can't sleep 12 hours because you're going to miss an hour of sleep. But you could add, because most of us are sleep deprived. So you can add an extra half an hour or an hour to your sleep. I think that is very easy to do. The same thing applies if you travel to a different time zone. You can start shifting your schedule, or sleeping a little bit more, because the overnight flight will kind of be terrible and you won't really be able to sleep as much. So that's totally fine to do, but it's never a full match. I think you can partially be effective at doing that.
Yeah,
sure.
Two interesting questions: white noise generators and melatonin. Any thoughts about those, both of you?
So we did a lot of research with white noise, and it's fascinating to see that depending on the noise in the environment where people live in, it can actually be very helpful. It could increase their sleep duration by 15 to 30 minutes at night. We had some people that lived just by JFK, and they were the best responders to white noise. So that I think can be very helpful. There is also pink noise, which is a little more musical, and that can also help people sleep. So we find that it doesn't help everybody, but I think it helps many people, particularly New York City or boroughs that can be very noisy at night. It wouldn't help with that garbage truck that comes in at 5 a.m. That may still wake you up at night, but it would help otherwise. Melatonin can be also very helpful, because most of us are probably melatonin deficient because of the amount of light that we're exposed to. So that's why my first melatonin measure is really the blue light glasses, because I think that will help you preserve melatonin. But if you need to take melatonin, there are different kinds. You have the typical melatonin that if you ingest may be in your system for a couple of hours, maybe 3 hours. And there is more sustained melatonin, 6 hour or 7 hour melatonin, that sometimes help you sleep through the night. When we do that, we do micro doses. I tend to recommend doses less than 1 milligram to get started because many people are able to respond well to that.
Does it matter what type of content you watch on TV or the types of books that you read? I know Dr. Singh is a big fan of horror movies. And I was just wondering, is that something that's really helpful if you want to get a good night's sleep? Or should you, should the content of what you consume, should that be more mellow or soothing?
Yes, I agree. It should be more mellow and soothing for most people. Some people are immune to horror movies and it doesn't make a difference for them, but for most people it does. Because during a sleep, you're reprocessing all that information that you learned. And if there is an element of fear or triggers any other unpleasant memories, it is really going to impact your quality of sleep. So we have to be very careful.
It's interesting, we talk about content, my wife and I used to watch the news before going to bed. That's obviously a terrible idea because then you start thinking about all the stuff going on in the world. But there's an app called Calm that's now worth like $1 billion, who they have a new feature or a couple years ago called bedtime stories. And basically they just read you a story in a very like calm, soothing manner about nothing. And just the voice and the soothingness, I think it works. It puts me to sleep. The question about white noise, I mean, we're big believers in white noise. My kids use it. It's blasting in our little tiny apartment in New York. And I've tried it and I fall asleep immediately and my wife just stares at me, and which makes her more angry that I'm so asleep so fast. But I like white noise. I think it is effective, at least in our house.
No, excellent points. Exactly. So I love those apps as well to train people and to know that they can really quiet down, because some people are afraid that they can't sleep and they think something is wrong with their sleep without realizing that what you expose yourself to is really affecting, the quality of sleep. Yeah, bedtime stories can be very soothing as well. Yeah, in comfort, I think we'll move on into your discussion of, mattress and pain and all. I think comfort is very important. Many people can't sleep well at night because they are uncomfortable. And pain can really disrupt sleep.
A lot of questions coming in, really interesting questions. Fitbit, using a Fitbit, monitoring the quality of sleep, is that helpful?
It's helpful so people understand what their sleep is, but honestly, the validation is really not perfect. We studied 400 people on Fitbit devices, and depending on the mode, if you use a sensitive mode or a regular mode, your sleep could be off by an hour in terms of duration. So I think it's good to study patterns and you say, well, if I read this or if I do that, will my sleep get worse? But don't take it as a face value. And I also don't endorse nightly use of those devices because they really increase your awareness of the electronics and the data and monitoring, and really they don't necessarily improve your sleep. So it's a helpful guidance, but not for a nightly use.
There's another device called Aura. They have a little ring sensor, and they have a score in the morning called the readiness score. So how ready you are. And I've actually have patients and even friends who use this. And if they're not that ready, that kind of informs how ready they're going to be the following day. So they make an excuse, I'm acting this way because I didn't sleep well. I'm not ready for the day. So it could have a counter benefit.
Right. Or you can call sick that day because the readiness is not good.
Right.
There's so many interesting things to talk about, the type of, the mattress and all these other things. The pillows, we'll talk about that. But there's one question here about the story of two sleeps, a few hours of sleep, get up, read for an hour, and then go back to sleep. Is that something people do? Is that helpful?
Well, sometimes people have a fragmentation of sleep, and what happens is that we sleep in cycles. So the whole night is not just one solid block. Every 90 to 120 minutes, we do wake up, and we may not recognize or be aware of that. Sometimes there is another factor that allows people to now become aware of that awakening. So it's really a fragmented sleep. Ideally, you want to consolidate it because that's the best sleep we get. Otherwise, you have to begin from scratch almost each time you fall back asleep. So we don't typically recommend that, but unfortunately, many people, that's how they manage their lives. I had a neighbor who was a very famous physicist, and he wrote all his books in the middle of the night. And he said, I sleep for 3 hours, I get up, I work for 3 hours, and I sleep for another 3. And that was, his entire lifetime. So sometimes people are able to manage that, but that's more of the exception than the rule.
All right, let's talk about spine and sleep a little bit more
Sure,
specifically. So,
like I mentioned earlier, a lot of folks ask, what's the best mattress or pillow to help with my back pain? And I go back to what I said earlier. I think it's really what you do during the day that's going to help your back pain more than the mattress quality and the sleep. But there are some small caveats with that can help prevent worsening back pain with sleep. So in terms of position, back sleeping tends to be the most supportive of your spine. But for various reasons, people can't sleep on their back. They might have sleep apnea. They have a CPAP machine. They might have other spine or orthopedic issues that prevents them from sleeping on their back. But the reason why this could be beneficial is because it eliminates stresses on different pressure points in your spine. So putting something underneath your knees, putting a little pillow under the small of your back, making sure your head is neutral. It's all about neutrality. You want your spine to be neutral when you're sleeping, because when you're in that deep sleep, you're not moving much, and you don't want to be in a sustained position for a prolonged period of time where there's extra stresses on certain parts of your spine. So this is kind of an example of back sleeping. Side sleeping, which is the next slide, is
real quick, I'm
Yeah.
sorry, Ricky, real quick. I think important here to point out is that support right in the middle of the neck, right? So you're really you're not kinking your neck, you're not like flexing your neck, but you're really kind of a little bit extending maybe. Is that
exactly
true?
right. And there's all these different companies that came out with like memory foam, neck contouring pillows, and some people love them, some people hate them. I tend to tell patients, get two very, very soft pillows that you can adjust how thick it is, so you're not too extended, you're not too flexed, and then even when you roll into your side, you can adjust it so you're not leaning one way or the other, instead of getting some of these more thicker pillows or these memory foam, because they're not as malleable.
Right.
So side sleeping, can also be very comfortable. I'm a side sleeper, but there is a way to do that. Again, the pillow is very important, so you're not leaning towards the right or towards the left. Your spine is in the middle of your ears, in the middle of your shoulder blades. People like to put something in between their knees, which takes the pressure off their hips, and also something, again, sometimes in your lower back. But side sleeping, people toss and turn because you get pressure points on your shoulder, you get pressure points on your hip when you're sleeping on your side. And then your body habitus also has a role. So if you're someone that's very skinny and thin-waisted, narrow hips, you probably need something that's a little firmer to support your spine. If you're a little heavier, if you have wider hips, your hips are going to bow down into the mattress, so you want something a little more soft that's going to accommodate that, so it's not pushing your spine up. And I have a picture of that. What's nice about mattresses these days is that a lot of these big companies have 360-day trials. They used to be 3 months, now 6 months, now they're 1-year trials. Casper, Purple, Leaf, a lot of these companies can let you try a mattress for a year and then send it back if you don't like it. So that's really a good test and a trial of if this is beneficial for you.
Is that true? 1 year?
1 year trials.
That's amazing.
We aren't sponsored by any mattress companies, so you go out there and pick whatever you like. And then stomach sleeping. I used to be a stomach sleeper. Most of my patients aren't anymore. My wife is a stomach sleeper. Just think about what you're doing with your neck and your lower back. You can't sleep face down unless you have a donut pillow cut out for your face. So you're turned to the side. You're in that sustained position for most of the night. You're going to probably wake up with some neck pain. And then your lower back is also extended because your pelvis is going up. You have a stomach that's pushing your back and your lower body. So again, I don't think it matters which position you sleep in, but if you find that you have excess back pain and stress when you wake up in the morning, maybe it's because you're a stomach sleeper. And you can look at this picture, see that pressure on the red in the lower back. The way to mitigate that is put a small pillow in your belly button, underneath your belly, and that'll kind of round out your spine. But these are just some quick tips.
I would think that if somebody has, for example, spinal stenosis, they may have a hard time sleeping on their stomach because they're extending the back, which makes the pressure worse.
Absolutely.
Right.
Either that or even facet arthritis, and these patients wake up with back pain. So putting a pillow under the small of your belly button can help, or just rolling onto your side and kind of doing a little bit of modified fetal position where your knees and hips are flexed a little bit. Those could just help you wake up less stiff. Again, none of these things are the treatment for back pain. That treatment is what you're doing during the day, exercising, fitness, mobility, but this could just help prevent stiffness. We talked about this already, pillows, that comes up a lot. That top picture is just neutral. You want your spine in between your ears, in between your shoulder blades. If you don't use a pillow, you're going to be a little too flex that way. If you use too many pillows, it's the other way. So just use something that works, trial and error. That's the best way to figure it out.
What about
I love-
this? Go ahead, please. Dr.
No, I was just
Krieger.
going to say, I love your suggestion with the pillows, because that's what I tell my patients, because you have to move at night. Nobody can sleep in one solid position, right? There is always a movement because you want to alleviate pressure sore. So having a pillow that you can easily adjust, there's not too heavy or too warm, can always be very helpful.
And you mentioned something there about, warmth and cooling. A lot of these memory foam mattresses, they work on body warmth, and that's how they contour to the body. But then people get too hot. And you said it earlier, you need to kind of sleep in a cool environment to get your body temperature down. So now they've started adding these cooling gels, which you probably know, to these mattresses that kind of compensate for the memory foam warming up. But just one thing about temperatures.
What about sleeping in a recumbent chair or a chair, or if you're not flying business in an economy seat? Is that by definition, is that bad sleep or inferior sleep, or can you sleep just as well in economy as you would sleep in first class?
And I'll let Dr. Krieger answer that as well. But we have patients that do sleep in like lazy boys and recliners. Sometimes post-operatively they can't get to the bed or things like that. I'm okay with it for the short term. The problem is you don't really change positions then. You're not going to roll onto your side when you're in a recliner. You're going to sleep on your back in a flexed position, and that's going to cause pressure, prolonged pressure in certain areas, your tailbone, your shoulder blades, your elbows. So I don't love that chronically, but for a short period of time when mobility is limited, I think that's reasonable. But I wonder, Dr. Krieger, what you have to say.
I agree. I don't like that on the long run. I think a lot of people feel that it's comfortable for them to fall asleep, but I don't think the sleep quality they have is really ideal. Sometimes people feel they snore too much. They may have sleep apnea, so they like to prop themselves up. Luckily now we have beds and mattresses that can elevate the head of the bed, and sometimes that can be helpful. Sometimes people have reflux, and that is also another good way to avoid it. But really as a short temporary solution, not really for the long run. I completely agree. And regarding the airplane, I think, sleeping in a recliner is more like a business class seat nowadays. I think economy class for an overnight flight is terrible. Being from Brazil and having done overnight flights, hundreds of times over the past 30 years, often in economy class, that's really a killer as you get older. If you're young and really exhausted, you could sleep any place, even standing up. But as you get older, body parts really hurt. So it's really not adequate sleep.
Now the most important question, mattresses, right? That's what everybody wants to know.
Yeah, so we talked about this a little bit earlier. Everyone's body shape is a little bit different. Everyone's body weight is a little bit different. So just finding something that works for you with these new trial opportunities is really valuable. I mentioned, wider hips. You need a little bit more cushion. Narrow body. You need something that's more firm. But trial them. I'm a big fan of body contour memory foam with the cooling gel. I think most of the people have gotten rid of spring mattresses. People say you should get rid of your mattress every 5 to 10 years anyway. How many people on this, myself included, have had a mattress for more than 10 years? So just think about that and trial and error, use one of those companies, use our promo code. No, I'm just kidding. And see what works for you.
But in general, if you had to give advice to patients with back issues, I think from looking at the literature, and it seems like a medium firm mattress is what most people recommend, rather than like a soft or like a really, really hard mattress. Is that correct?
Yeah, most of the data, if you look at the spine literature, says medium firm or firmer.
Yeah.
And that's kind of a catch-all. It does depend. Everyone's a little bit different, but overall, if I haven't evaluated the patient and someone says I have back pain, I think starting with a medium firm or firm mattress is reasonable to start with and see if that agrees with your body. But yeah, that's what the data says.
What about the impact of dreams and your well-being and your perception of pain, or is there a relationship with that? Like whether I mean, we probably always dream, but we just don't remember, I guess. But is there anybody working on that, trying to figure out the quality of your sleep and what you dream? How does that affect your perception during the day?
Yeah, that's a great question, Dr. Krieger. I mean, I'll say my quick comment on that. I think, we talk a lot about mindfulness and behavior modifications. I think there definitely is a role in how you perceive pain that can impact your sleep quality. But in terms of what's going on at night in those different cycles, Dr. Krieger, I'm interested to see what you have to say.
Yeah, so dream research is very interesting. Rosalind Cartwright, who died a few years ago, was a long time sleep researcher, and she was really focusing on dreams. And we have one of her trainees that is still working on dream research. It's complicated to research dreams because the content really has to do a lot with your experiences and exposures and your ability to process emotions as well, not just the information, the content you're exposed to. What goes on during dream sleep, as far as we know, is that the neurons are like trees that are interconnected and they get pruned at night. So during REM sleep, let's say there is a road that needs to be paved because there's a lot of information now going through that road. So the neurons are clearing out the side roads, then increasing that connectivity on the specific pathway. So we all have dream sleep, which is rapid eye movement, is REM sleep. And it happens every 90 to 120 minutes. So at the end of each cycle of sleep, we have a chunk of REM sleep. Each cycle, as the night goes on, you have more and more REM sleep. So sometimes people are very depressed. They may have a lot of REM sleep. And part of the treatment of depression is really to cut down the amount of REM sleep people have. And many of the antidepressive agents, they also inhibit or decrease the amount of REM sleep. So REM sleep is a healthy, natural state that a lot of this reprocessing, rewiring is taking place, but we might not be able to recall because you may have memories associated with that and dream content coming out of it, but doesn't necessarily mean that you will always be remembering that. Sometimes people may have nightmares, and some people that may have sleep apnea during REM sleep, because the brain is so active, the muscles lose tone. So apnea can get worse because the airway muscles get weaker. And sometimes it can present itself as nightmares, let's say. So we always want to pay attention to what people describe that is unusual about their sleep. Sometimes medications like beta blockers can actually increase the presence of nightmares. So it's something, the change in the pattern is what we're always looking for. If something is different, we definitely want to take a look at and determine what could be happening.
Well, thank you. That's really fascinating. Well, we have a lot of questions that we didn't get to, so apologies for that, but I hope that we were able to answer some of the burning issues at stake here. As we're closing up.
Speaking of burning, Dr. Hartle, sorry to interrupt you. A lot of patients tell me that they feel burning pain more at night and then not when they wake up and move around anymore, or they have more pain at night, not when they move and are distracted. What do you say to that? Is there some science or the reason why pain is perceived more directly and more consciously when you're not consciously, but more when you're sleeping?
Oh, that was for me.
Sure.
Yeah, possibly. I think what happens that when you have less distractions, right? I think the pain may become, more noticeable, but there's also, I think, positional effect, right? With back pain or a sore or a pressure in a specific joint that may be exacerbating the pain. But it could be more noticeable at night because you're just moving during the day and you basically don't pay much attention to that. So that can definitely be a factor. Yeah.
Yeah, Ricky, I know we always talk about my personal history as a back pain patient myself, but I had a really bad back issue, 12 years ago, and I had a herniated disc, and my pain was worse at night. And I had the impression that it was because my muscles were relaxing, and then every time I would move around in bed, I would get this jolt of pain. And during the day, my muscles were always tight and were kind of stabilizing my back. So I think that's a very mechanical reason why people may have more pain at night. I hear that from patients all the time, and that's always to me is always a sign that there's a component of instability there, and that the muscles during the day, because they're so tight, they keep the spine stable and maybe control the pain better. But I think we're at the time we got to finish up. People want to go have dinner and enjoy the evening, and I'm sure Dr. Krieger, you're in Central Park, so you probably want to go for a nice walk.
Exactly.
But, I wish Dr. Singh a lot of sleep this week and sweet dreams, so he's ready on Sunday for the marathon. How many marathons have you run, Ricky, yet?
0 today. This year's my first.
Wow, amazing. Well, Dr. Krieger, do you run marathons or?
No, I'm not really a runner.
Nor
I
am
tried.
I.
I tried. I just realized it was not the sport for me.
Well, we'll be watching Ricky. So good luck,
Yes.
Ricky. Thank you very much, Anna, and everybody else at home. Enjoy your evening. Get some
Thank you,
sleep.
everyone.
Thank you, everyone.
you.
Good night.
Bye.
Bye.